wanted to take the opportunity to thank Mitt Romney on the 5th anniversary of the healthcare reform passing in Massachusetts. We are so grateful for him for being an advocate and a inspiration for Democrats across the country in our striving for healthcare reform and bringing proper healthcare to Americans everywhere, not just Massachusetts. My family had a kind of crash course in why we needed healthcare reform. My husband worked for an employer who was less than ethical and stopped paying our health insurance without telling us. So we were left without health insurance for a total of about 6 months without knowing it. It's really not fun finding out retroactively that you don't have health care. And I look forward to the day that not only do we have health care that is free from pre-existing condition clauses as we do today thanks to our reform, but that we have a health care policy that is open to everyone and not subject to employment. And I look forward to that continued work.
Let's keep this focus on Mitt Romney and Barack Obama, because these two national leaders have really done more for healthcare reform than anybody in my generation. And I want to tell you a little bit about Mitt Romney that is a personal story about healthcare reform, is that my family lives in Western Massachusetts. My uncle was actually a Republican state senator in Massachusetts in the mid and early 80s, mid 70s to early 80s. And I was visiting my father, who's at a retirement home, and in the elevator was a picture and a flyer asking people in the center, in the facility, to come to a meeting to know more about Senate File 421, which was the new Healthcare Reform Act in Massachusetts. And it talked about open access, universal coverage. It talked about new plans and affordable plans for everybody. I took that down from the elevator, so I don't know how many people I prevented from going to these meetings, and stuck it in my pocket and came home. That was in December of 2006. In January of 2007, as a chair of the Health and Human Services Budget Committee, I held 6 weeks of hearings on healthcare reform and put together our first initiative in 2007, modeled after the Massachusetts model, where we had a healthcare exchange, where we had new plans, where we had greater access for kids. We had payment systems that providers would have to adhere to, all coming from Massachusetts. And we started our reform. And as a result of Governor Romney signing that bill, it opened the floodgates. Not so much of what a model is, but it opened up the floodgate that states now were participating in a national plan to provide health care to everybody in their state. As a Democrat, we've been talking about this for 50 years, but never were we able to do anything substantive with healthcare reform. In 2007, when we passed the bill that created our first healthcare commission and provided $500,000 for this commission, that this commission is really the genesis of all the healthcare that came afterwards from 2008, 2009, last year. All stemmed from the fact that we had an opening. Governor Romney provided that. He's the only governor that signed such a progressive type of health care. And now I think we want to learn more from him. And I don't think he should be running away from it. I think he should be coming to Iowa, talking to Iowans, Republicans or independents, to talk about why health care is important. To be engaged in this conversation is a sense and a value of real leadership. That's what Iowans expect. To run away from it means that he's no better than the previous Republican candidates for president. Not wanting to talk about it, denying the public a real discussion about how healthcare reform can help them, help their children, eliminate the fear and insecurity that not having health care has. We saw with Tanya and many other small businesses that this healthcare reform provides a real avenue for them to participate. Provides tax credits for small businesses, lowers their healthcare premiums, provides a greater mix of healthcare plans that they'll be able to choose from, and identifies some real opportunity for families to feel secure. That's what Mitt Romney helped do in Massachusetts. That's why it is a requirement as a national leader to talk about what healthcare can do for Americans now that we're going into this next phase of healthcare reform.
This accomplishment by Governor Romney was really groundbreaking. It was a seminal move that got us moving and allowed President Obama some room to stand on. I think it is absolutely imperative that, as Senator Hatch says, Governor Romney needs to come here and talk to us about this. He needs to talk to Republicans, independents, he needs to talk to Democrats and Iowans, because the conversation starts here. And this is a really important part of the national conversation. There is no other candidate on the Republican side that can answer questions about this issue like he can answer them. There is no other candidate on the Republican side that can talk about what he thinks about this movement on their part to repeal healthcare reform. Does he think that that's a good idea? He needs to answer that question because it's part of the conversation and nobody's more qualified to answer it than he is. So we hope that he does come. I know that this is some tongue-in-cheek, and there is a thank you card, and there is a little cake for celebration, and we are in fact in a business called Simply Giggles. So there's some tongue-in-cheek with this, but the serious issue is that the national conversation must include, as we move forward, healthcare reform, how it's working, how it can work better. That's an American conversation. That's not a Republican or Democratic conversation. We look forward to seeing him here, as we have hoped that we are welcoming to all of the other men and women that are part of that conversation, as we look forward to having that conversation on our side when President Obama and many other national Democratic leaders come. So we're excited about the start of it and hope to see him soon. Thank you.